Welcome back to the Postpartum Standard. I'm Toni Toomey, and I'm joined today by Dr. Niku. Thank you so much for joining.
Hi, everyone.
Awesome. Let's dive in. Usually I say, tell me your motherhood story, but it's a little different here. So, what drew you to obstetrics?
Oh, man, I get that question a lot, especially for my PA students who come and rotate with me. I'll give you the short version. I actually thought that I was going to I always wanted to do medicine. And I actually ended up going into OB because I wanted something of like the surgical field with a little bit of pediatrics. Those were the two fields I was looking at. And then the first time in med school when I did an ultrasound by myself on a pregnant patient and I saw the baby, it just kind of like snapped. Like it just something drew me to it. I will tell you, it's not something for the faint of heart. It's a challenging experience, a very adaptable experience that has been over the last few years. I'm always learning. All doctors are trying to learn. And I'm telling you, like every day, there's something new that I'm learning. And I think that's what's drawn to me. Over the last few years, has also been an opportunity to have my hand in different pies per se, to like really like, and cooking with this and working with that. And like, that's the beauty of it. And more so now I realize how I can see patients over like a long period of time, from their youth to like later stages in life. It's wholesome. It's very circular. It's a beautiful job. It's a challenging job, but yeah. Yeah.
That's so beautiful. It's so cool that that just like light bulb moment happened for you and you
Yeah, it
knew.
was. It really was.
That's awesome. What is something that you wish like all women knew maybe before they get pregnant?
One of the big things for me has always been know your history. I think coming in, we want to empower a lot of our patients or our women who are pregnant or not pregnant even. They walk into a doctor's office and they're just kind of there to figure out a problem without knowing what's wrong. So like, and what's remarkable, at least what I've noticed, a lot of people are taking ownership of their health over the last few years, and a lot of new ways that a lot of doctors, including myself, are learning to adapt to and understand. And for instance, the field of functional medicine or naturopathic medicine, acupuncture, chiropractic has always been on this side and medicine has been on the other. And there's been a little bit of a movement where there's been a gradual twining, and more so now than ever. And women are learning to be a little bit more empowered with their health and understanding what that is. So knowing your history is key. Knowing your family history. What medications have you taken? What are you on now? Because that for us helps, figure out the puzzle. And that's what's important. I think that's one thing I would tell women to know and understand about themselves before they walk into any doctor's, let alone an OB's office for them.
Yeah. Are there any like resources or tools that you like to recommend to women to kind of like collect that history or like kind of
There
have that
isn't
all in one
anything. I mean, we have our technology now. Like, I mean, our iPhones have a health tracker, and it's just very easy. But I get the 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 fear of having your data extracted. So guess what? We have pen and paper. Write it down. Like my dad's old school. Like he still has these notebooks. Every year makes a new notebook, has everything written down. And it's comprehensive, but if your history is very easy, then there's not much to worry about. But I think knowing yourself, and I think, and I can comment on for myself, like I've learned to listen in a way that like, okay, the patient is coming with a complaint. Let They're giving me information. Now it's my opportunity to come in and extract as much as I can. That's my job. That's what I'm supposed
Yeah.
to do.
Yeah. So obviously like the patient doctor relationship is always very intimate, but even more so I think in your line of work. What are some questions that you think women should ask when they're like interviewing OBs to kind of walk that journey with them?
Wow. My wife said when I went over the questions that there was like, I saw that question there and she's like, you got to be ready for this one. She's going to ask you. And I'm like, okay, okay. I think the one question or the few questions that patients should come is let's talk about OB in particular. And I'll give my gynecological perspective also. For OB, you want to know how can I communicate? Like, how can I be there for you as much as you're going to be there for me? So there's different forms of practice here in LA and, across the world. A lot of doctors are in group practices. Some are individualized and private, like myself. Others work with midwives, others don't, and there's midwife groups. So it doesn't matter who it is, you're seeing, you want to be able to say, like, how can I communicate? What do you need from me so that I can give you the information that you need so that you can help me and make it a mutual relationship? Communication is important. So that's the thing that I try to provide for my patients. And that's what people should look for in their doctors. What is the relationship? Like you said, it's an intimate relationship. Someone's relationship won't work with me, and others are like, I just want the doctor to be cut and dry, get me in, get me out, and I'm done, kind of thing.
Yeah.
I think the other question that I would encourage patients to ask is, what are your thoughts on, for instance, inductions? What are your thoughts on C-sections? What are your thoughts on this kind of practice? So like, I think in particular, inductions is a very challenging subject for patients because it gets a little bit of a bad rap. I think there's a lot of medical and personal elective use for it, and to each their own. Just because your experience was one thing doesn't mean it has to be for the other. So I've had patients who come to me, it's like, I'm done. I thought I wanted an all unmedicated, my husband helping you pull out the baby kind of thing, to like, I need an epidural and be induced right now at 39 weeks, and everyone to their own. So like, it's a good set of questions to ask. And I think it gives a little bit more strength to know where your philosophies align.
Yeah. Oh, that's so true. And it's funny because I think as a mom, you have like in your head the way that you want birth to go, and you don't really think about the things outside of that scope. Like, I wanted a home birth, so I didn't really think about like, okay, what happens if I have to transfer and I have to get a C-section? And so then I found myself there in the hospital asking this poor doctor a million questions while I'm having contractions. And in hindsight, I'm like, oh man, I should have covered all of this before, and so that I had the information to make the decision, because it was much more difficult.
So I cover from as a private practitioner, I've chosen to align myself with a few midwives. I'm actually looking to expand my practice to hopefully one day incorporate that a little bit more, because I find that in this, in particularly LA, there's a desire for that.
Yes.
But for the midwives that I've worked with, the first thing I tell them, if you're going to deliver with me, they need to meet me. They can't, like, my philosophy has always been, and this is nothing against any midwives, I'm putting this disclaimer out there. There are certain circumstances, I'm guessing like yourself, where you walk in, it's surprise, like, what is the plan? And to have a plan in place is always helpful, so that, even surprises, you can be prepared for.
Yes. Yeah. Yeah. In California, is it legal for midwives to like deliver babies on their own, or do they always have to have like an OB?
So they can deliver on their own in the hospital setting, as long as they have, like at Cedars, for instance, one of the midwives at backup, she has privileges to deliver as a private practitioner, but she needs an OB to be there as the backup. And that's what I help.
Got it. Okay. Yeah. It's crazy how varied that is from state to state.
Yeah, it really is. It really is.
Yeah. So, what are some symptoms or concerns that get dismissed as like, oh, this is just normal pregnancy, that when you hear a mom or a pregnant woman say it, you're like, ooh, let's dive on that.
I think the biggest one is always cramping and bleeding in the first part of the pregnancy is always very scary. So because it's not uncommon for a normal pregnancy to have that happening, and it's causes some concern. Is it a miscarriage? Is it something I did wrong? And then, or is it ectopic? Is it, so you start running down this gamut. So it's not uncommon, but it's something that should not be dismissed. It's something that you should, let your, doctor know, like, hey, this is happening, and go through the set of questions like, what were you doing? Did you have intercourse? Are you exercising? Were you taking any medication? Like, all these things helps us, again, piece that puzzle together to say, okay, why don't you come in? Or, hey, this sounds not safe to me. Let's assess that and go from there. So I think those are one of the bigger things I recommend to patients to be on the lookout for, to not let that be dismissed. when a C-section happens for a patient, it's understanding what your options are for the following pregnancy, and to know that options are available to you, and that in this, when you get pregnant again, is to be aware of any pains or discomforts, and knowing what your options are as the pregnancy progresses, to be prepared for the worst and the best case scenario. So
Yeah.
I know it's not a symptom, but I think a trial of labor is always something that's underutilized and overlooked by a lot of practitioners. And it really is individualized, but I think that's something to discuss and to be prepared for any of those risk factors if they come up as a pregnancy goes on.
Yeah, that's such a great point, because I know a lot of times women are like, they have their heart set on the VBAC and they're just like, no, I'm doing this. And I know
Yeah.
for me personally, like I can be very stubborn, and that's like something that I would definitely have to watch out for.
I mean, I'll give you a great story. It just happened a few weeks ago, and I asked my patient if I could share her story, and she was okay with it. She had her first baby. She had a C-section. She had pushed for like 3 hours. The baby's heart rate was not tolerating very well, and I had to do a C-section. And thank God everything was okay. And second one, she was like, I'm adamant that I'm going to do a trial of labor. I'm like, great, I'm on board. We got her a doula. She found one that she liked. She was doing all the exercises. Everything was great. I kid you not, 39 weeks and 5 days, walked into the office. I scanned her. The baby was breech.
Oh my gosh.
He was like head down the entire time. I went the following day to the hospital to rotate the baby, to flip the baby, and the baby did it by itself.
Oh
And
my
this is on a
gosh.
weekend. So we discussed our options. She's like, listen, I'm not ready to be induced. I'm like, understand this. And we talk about the risks and benefits. She's like, I understand. And she said, like, over the weekend, she felt pressure again. Something was off. Monday, she came back. The baby had flipped back up again.
Oh my gosh. That's wild.
And when we went to do so she decided, you know what, I don't want to play this game. It's not safe. I'm going to do a C-section. We went and did the C-section. During the middle of the C-section, the baby was flipping down.
That is so wild.
I couldn't believe it. Like, I was like in the middle. It was, and it goes to show, like, these are things that you can't be prepared for. Like, I could tell you to be prepared for everything. And in my line of field, the unexpected always happens. Always.
Yeah. I can't even imagine like a baby having enough space to rotate in
Yeah,
there.
it's pretty wild.
I'm so short, and my torso is so short that like there's no way my daughter had any any room to move. Like, that is wild. What do you think is one of the biggest like misconceptions about labor and delivery in like a hospital setting? There's a lot of people who are scared of that, or they're scared of hospitals.
I think it comes from, we're a village, whether you like it or not, and that village extends to family, friends, other patients, mommy boards, like, and everyone talks. We talk and we hear the goods and the bad, and sometimes we hear more of the bad when there's actually really more good things that happen. And I think it's important. I think maybe that's a question I was kind of referring to, like inductions, understanding what are the interventions that could happen. The intent, I think the biggest misconception is there's an intent to do what the doctor wants and not take the patient's needs in mind. And listen, I can't defend every doctor. There are circumstances, or any midwife for that matter, where circumstances happen where it feels like you're not being heard. It feels you're not getting the experience that you want, and you're being forced into something. And I can try my best to guarantee that that's not the case. So I would say that the hospital experience gets a bad rap because it feels very medicinal. That's exactly what it feels, very structured. So in my practice, how I try to do it, I try to make sure that there's a little bit of flexibility there. As an example, I try to encourage my patients to labor at home as much as possible, whether you have a doula or not. And if you're like, you call my patients in my practice, they get my phone number. So they have direct access to me. Not many providers do that. And so they'll call me, hey, I'm having contractions. I talk them through it. I'm like, okay, come to the office or come to the hospital. We reassess. And then we say, okay, you're 4 centimeters. I would not encourage you to get an epidural right now unless you really want. Let your body do its thing. Let things go down as they should and let it progress. And if it doesn't, then there are things that we can offer. The reason things get misconstrued is because we don't give all of the discussion that could happen with it. And even if you do, we'll mess up. And things will always, there's something that could go wrong. But I would say 99% of the time, there isn't always something that goes wrong. It's just personalized experience that kind of changes that.
Yeah. Well, and I think it's human nature too, to like remember and talk about the things that do go wrong. And it's like, I'm sure you've delivered hundreds of babies completely uneventfully, and nobody talks about those.
No, I wish I could talk about. So I had yesterday, for instance, I had 3 deliveries. I went at 6 o'clock in the morning, and the patient was she did not want to be in. Actually, 2 of those patients that I delivered yesterday did not want to be induced, but there was a medical reason to do it. I personally actually don't like doing elective inductions. So I brought them in. They made great progress. The first one needed a vacuum because the baby's hand was stuck like this and was not coming out. If I hadn't done that, she would have had to have a C-section. So I pushed the limit. The other one was a first-time mom. She pushed in 8 minutes. I'm like,
Oh my gosh.
it was. I have never you never talk about the good outcomes. You only hear, unfortunately, the bad outcomes. And I wish that wasn't the case, but the good doctors, the good midwives, the good practitioners are the ones who learn from the mistakes or try to do something better so that it evolves from not the mistake, but the circumstances that weren't desirable to make the next one better.
Yeah, absolutely. I mean, it goes back to what you're saying. You're always learning.
Yeah,
And
always.
every experience informs the next one.
Correct.
What do you think is something that moms like worry about that they shouldn't? Kind of along the same line with getting induced, and like, what are the worries you hear all the time? You're like, that you don't have to worry about that.
The baby's heartbeat, the baby's
Yeah.
movements. And I think it's valid to feel that way. I at least get, if I do let's say 10 to 12 deliveries a month, at least one patient a month is going to say, I think I'm going to go buy a mini ultrasound and I'm going to look for the babies. I'm like, please don't do that. You're just going to, and I think the biggest, it's stress. I think the thing that makes pregnancy harder in this day and age is we're so bombarded with information that we have done a disservice to ourselves
Mm-hmm.
by taking other people's experiences and saying that it's our own now. Oh, I heard that this patient's baby didn't move and I freaked out. We're creating more stress. And I've searched for an answer and I'm still trying to find a way to make it better for myself. I can't solve everyone's problems. But I think the thing that helps the most is educating patients and taking that extra minute to say hey, it's okay. We got this. It's fine. My wife was the same way, by the way. She panicked and she has an OB as a husband. She's like, I want to hear the baby's heartbeat. And until she felt the movement, that she felt normalized, that it felt okay. But I don't blame anyone for that. It's just movement and stress are probably the 2 biggest things that I see all the time.
Yeah.
Yeah.
You're so right about social media. Like you hear, I mean, back to the same thing, like people glorify the bad. And so the story about the one bad outcome that happens like 0.01% of the time is the one that blows up and goes viral. And then everybody starts freaking out. And as a mom, like you're already nervous because you're growing a tiny human. And then you read that story and your brain just starts running of like, oh my gosh, this can happen to me. For me personally, I'm kind of a data nerd, and I would always, every single time I started freaking out about something, I would go and say like, okay, what's the percentage chance of this actually happening to me? How often does this actually happen?
And
Do
I
I
actually
think I'm that important?
and I encourage my patients to do that. Look,
Yeah.
Dr. Google this stuff, Chat GPT this stuff, but we are there to guide that kind of misinformation that's there already. I think that's another thing. People get freaked out that we're going to judge. No, just come talk to us. Well, can persistent questioning be of a burden on our shoulders? Absolutely. But if I don't do my job at answering those questions, then I'm doing a disservice.
Yeah. On that same note, what do you think is a way that moms can like advocate for themselves without feeling adversarial. I know, like for me personally, that was really hard because I'm a people pleaser. And so I was always worried about feeling like contentious.
Yeah, absolutely. I think it goes two ways. One, from the doctor's end, we have a tendency to be like high and mighty. I think that's the misconception. And I went through 14 years of schooling. I know this. The reality is we don't know a lot of stuff.
Yeah.
And we know our field well, but there's things that change with that. And we have to be adaptable and understanding. And I'm trying to learn every day too. There's always an opportunity to learn and adapt that. So if a patient is bringing something, it's like, okay, tell me a little bit more. Where did you learn about this? How can I do that? So I think being open at that end allows that adversity that patients may feel from a doctor melt away. We tell the patient and their to just give us an opportunity to explain. Like, listen, I tell my patients from the very first, for instance, for the obstetrical meetings, for the first time they come in and they're pregnant, I say, listen, this is XYZ. This is your pregnancy, not mine. I take philosophies from medicine. I try to learn from my midwife and doula friends, and I want to make this your experience as best as I can. If I can't do that, then we'll find ways to adapt it. The only way that I would increase that intervention is if there's a medical reason. That's why you come to me, so that I can take care of that. So it goes both ways about being open-minded and understanding of one another.
Yeah. That's a great point. And I think that goes back to like finding the right doctor where you feel like you can bring those things and not feel self-conscious. What are some things that you think actually contribute to a smoother labor? So talking about social media, there's so much stuff on there. If you do
Yeah,
X, Y, and Z,
yeah,
your baby's gonna walk out.
yeah. It's interesting. Like, listen, I go on social. I have a social media. I do a lot of education on it. I think my favorite things that can help the labor process or the weeks leading up to it. I was a doubter about this, but I think it works. I think there has been some studies. Don't quote me on the exact study because I can't remember. Um, uh, dates, eating
Mhm.
dates can help soften the cervix a little bit, and I've seen that happen. I have seen patients. I have encouraged patients to take raspberry tea leaf from times that can help with the uterine muscles as well. Um, Mobility. So I deliver at Cedars, so they actually incorporated spinning babies, which is a set of
Nice.
set of maneuvers. I actually took the course with them, and it was a great learning experience because I found some patients that I would have otherwise, they were not making progress in their labor, would have had a C-section, ended up having a vaginal delivery because those are some maneuvers and stuff like that we can use.
Yeah.
Um, Pelvic exercises like pelvic floor therapy is a great thing to understand where, like, to push and to understand where your pelvic muscles are. And I think the other thing is it gets a bad rap, but pushing on your back, it doesn't need to be the only position. There
Yes.
is flexibility to do other positions even with an epidural. At least I think so. While the majority of women will be on their back, I think there should be some maneuverability. And I think those few things can help get you to the promised land, so to speak.
Yeah. That's so interesting. I had no idea that if you got an epidural, you could still push not on your
Yeah.
back.
I mean, why not? I still remember that. I'll never forget this one. This was a couple years back. This patient got an epidural. She got on top of the bed, like latched the top of the bed, and was squatting down. And she was making progress that way with an epidural. I'm like, okay, do it.
That's
And then
amazing.
as we got closer and closer, I'm like, listen, we need to get control of the baby. So she came on her back, pushed on her side, and the baby came out, and it worked out.
That's so cool.
I
Yeah,
mean,
I
why
think
not? I mean, why
yeah.
not?
I think I'm just thinking about when I had a C-section, like I couldn't do anything
Yeah, you
from
couldn't
the
do
waist
anything. Yeah.
up. I was just laying there like a starfish.
What was your experience like with the epidural? Like, it's pretty weird, right?
It was the weirdest thing ever, and they kept having to the anesthesiologist kept having to do something to keep me from passing out because I was,
Like,
like, super shaky and just pale as a ghost, and, like, 3 separate times she had to, like, do something to keep me from passing out, but I was shaking I think just from like the adrenaline of labor, even before I walked in. And so I was actually really scared for them to do the epidural because I was like, I don't know if I can like be still long enough for this to happen.
Yeah.
And I was like,
Yeah. Very
I'm
common.
gonna, yeah, it was, but it was weird when they actually pull the baby out. Thank God they warned me because otherwise I would have freaked out. But they were like, okay, you're gonna feel a lot of pressure, and it's just gonna like feel like something's sitting on you. And then there she was, and the first thing the doctor said was, "Is that a redhead?" And my husband and I joked because my mom was adopted, but her mom, the only thing we know about her is that she was a redhead. And my husband is Irish on his dad's side. And so we joked before, like, we both have brown hair, but we could have a redhead. So when the doctor said that, I was like, oh my gosh, and
So
sure
does she
enough,
actually have red hair?
yes, bright red hair.
Oh,
Yeah.
wow. You don't get that
Yeah.
very often. That's crazy.
That's what
Wow.
the doctor said. He was like, I don't get to deliver very many redheads.
That's amazing. I love that. That's great. Well,
Yeah.
I'm glad that she's here. How old is she now?
She's 2. She just turned 2 in November. So
Amazing.
yeah.
Oh, my daughter was born in November.
Oh, nice. So
Yeah.
it's November 18th is her birthday.
November 29th is mine. So yeah, that's
That's
so
so funny.
crazy. Wow.
Yeah.
No.
It has been the most beautiful journey
I
and
agree.
like led me to doing this, which is just so cool, and sharing all of these like resources with other moms because I realized that while I had like the resources financially to be able to hire a doula and go see additional doctors and like do all of this extra education, I recognize that our system isn't really set up for everybody to be able to access that. And we paid out of pocket for that stuff because insurance didn't cover it. And so we just did it. And so I'm trying to kind of bridge that gap and
I love that.
yeah,
That's
help
great.
provide some resources. But so along the same lines of like postpartum, what kind of postpartum care do you recommend moms like get in place maybe before baby gets here? Because once baby gets here, like you're in survival mode.
Yeah, yeah, yeah. So I think you hit an interesting point right before this. Like some patients have the financial means and others don't. And even if you have the financial means, it takes a village. My wife and I are very lucky that our families are here and we have support. And we were able to, they would come, they would drop off food. And a lot of patients don't have that. And it's a shame because your focus is so much on the baby that I still remember I developed postpartum like sleep disorders a little bit too. Like, and some fathers are very involved and others are not. And, you know, some moms need a little bit more support and some can't do anything. They're experiencing postpartum depression and anxiety. They feel anxious about breastfeeding. And to have a village in place, whether that's friends or family or support system or even like a group, it goes a long way to have someone that you can turn to. And you want to make sure that you also pre-pack some stuff, some foods, and you know, if you can, the weeks leading up to it, just get a bunch of snacks that you like, have it ready. Broth is one of my favorites, you know, and I think bone broth or chicken broth was very helpful, especially when my wife was breastfeeding. She just could sip while she held the baby.
Yeah.
Um, and I think visiting your doctor a little bit more frequently, or your midwife or whoever you deliver with a little bit earlier. The general recommendation in the past was within the first 6 weeks. I know a lot of midwives and doulas don't do that. I don't do that either. I typically see my patients around 2 weeks and then 6 weeks and 12 weeks.
Right.
I do that because one, the recommendations are slowly turning to that. Two, we miss a lot of things in the first 2 weeks and a lot of support is needed. And I'm actually trying to find a way that I can actually have patients be seen within a week or like some kind of follow-up program to do that for my patients. But that takes a little bit of bandwidth that I need to figure out for. But support system and being able to see your practitioner or the person that's taking care of you a little bit sooner, I think goes a long way, making the postpartum experience a little bit better.
Yeah, I love that so much. That's incredible to move towards seeing them more often. And the 12-week. I just had a guest on the other day. We were talking about postpartum depression specifically, and she was like, I didn't develop it until like month 3 or 4. And so, you know, you go to the 6-week appointment. If that's the last time you see your doctor, then it just kind of gets missed. And for a long time for her, she thought that what she was experiencing was normal and just part of
Yeah.
like the hormonal shift. And
Yeah.
so along those same lines, what are some like signs that you recognize clinically that would kind of indicate maybe postpartum depression or postpartum anxiety?
Oof. Ooh. Red flag number one is patients that have had a history of anxiety or depression prior to or during pregnancy is a red flag to look out for. Number two, you kind of pay attention to the partner a little bit too, how involved they are. I try to give the partner a little bit of the benefit of the doubt because they're a deer stuck in headlights kind of thing. But you start to notice sometimes this guy or this partner is not very involved and it's taking a burden on the patient. And then number three would probably be the depression scale that we do within the first 2 weeks that I try to do to kind of pinpoint, because typically anxiety leads to the depressive symptoms. And I would say every woman typically has a anxious episode. Am I feeding the baby right? Why isn't the baby sleeping? Is the baby breathing? Like, even I had the panic attack. I love telling this story because I was sleep deprived. Took 1 week off after my baby was born.
Oh my gosh.
And I think it was within that following week that I woke up because I was panicked that something was wrong with the baby. I was standing up in our bedroom holding the baby like this. My wife's like, "What the hell are you doing?" I said, "I'm holding the baby. I'm trying to give her to you." She's like, "The baby is in the crib right now. She's sleeping." I'm like,
Oh my
"No,
gosh.
I'm holding the baby. She needs to be fed." She's like, I had nothing in my hands. I was just holding up air.
Gosh.
So, like, knowing that there's that support system, like it's a
Yeah.
mutually beneficial. So that kind of anxiety that the patient has is so valid, and looking for that is so important, and talking about it and not even belittling it, being on like, it will come out of out of nowhere. And it's scary sometimes because sometimes intrusive thoughts come in, like, I want to hurt the baby, I want to hurt myself, I would never do that, but like, why do I feel this way? And if you miss it, it can become something, and you don't want that.
Yeah. Yeah, it's so wild. Like, I used to always worry that I was gonna hit my baby's head on the wall when I was walking. She was so tiny. She was, like, smaller than me and just fit in my arms. Like, it's a bigger risk now that she's 2 and flops
Yeah,
around
100%.
everywhere.
Yeah. It kind of makes you wish that you go back to those days a little bit too.
It was so nice, like, nursing her when she would just lay there, and now I have, like, a foot in my face when we're trying to nurse. It's so yeah, so wild, but I those are good signs to look for on the depression side. I know, like, when I was younger, I struggled with depression, and so it was something that was kind of top of mind for me in my postpartum season, and luckily, like, I don't know why, but it didn't come back up, and I feel like there's not really, like, a rhyme or reason there. Like, is there
There's,
anything that moms can do to help prevent it aside from supportive partner and village, but, like, nutritionally or
I think staying up with your nutrition, eating is very important. I think that gets a little bit lost for patients. Um, Finding a routine that actually works. I know this falls on a lot of deaf ears. Like, how am I supposed to do that when I have to feed every 2 hours? You're a man, you're telling us this. Listen, I'm just telling you from just experience that it goes a long way for routine. And listen, I can sit there and make a routine with you, and you may not follow it, or you may, but it's fine. You gradually learn the tricks that will kind of get you where you need to be. Um, so eating is important. Sleep, even if it's like 15 to 20-minute nap, it's hardest the first 6 months. It's honestly hardest for 6 months. And I think for specifically anxiety and depression, I don't know why, even now with mental health being so important, people are still terrified of talking about it. They're
yeah.
afraid to say, like, as if they're going to be judged. I'm like, and there's so many great programs right now that are available for moms. Mavita Health, for instance, is one of a friend of mine who two people that I know, they made this program. One's a psychiatrist, and they blew up. They really found a way to provide postpartum and reproductive mental health programming for patients, and it goes a long way. if we don't provide that,
Yeah.
we'll miss things. People will not be well.
That's so cool that they've built something that amazing. It is so hard, I feel like, as a mom to feel, I don't know, comfortable bringing that stuff up. And you're right. Like there's still so much stigma to it, even though mental health is such a part of like the general consciousness and conversation now. But there's still like this unwritten expectation of like, oh, you're a mom. You're supposed to have it all together and figure it out.
I want to know the mom that has it all together.
Yeah.
Like and it's few and far in between that some people have it well together. I applaud every single person that has a child, like went through this process. My wife's a lawyer, and she's working full time again, and I get it. I get it. It's probably one of the hardest jobs and probably the most unrespected job that it's so undervalued, and I feel even dumb as a man complaining sometimes.
Yeah, I was just talking to a friend about this morning whose baby just turned a month old, and she's having all of the mom realizations of like, oh my gosh, this is such a crazy experience and it's so transformative and it's so hard. And I was like, yeah, and like you didn't understand any of it until you lived it. Like you could
Yeah,
conceptualize it, you could hear people talk about it and know, but it's like until that switch flips and you're on the other side, like you just have no idea. And I mean,
100%.
I'm sure it's the same for dads. I know for my husband, like he had no idea what to expect. And
Even now, I have no idea. Like, I think my wife wants to kill me from time to time because I will say, like, so what's the routine again? Oh, what are we doing? And it's like, you dumb, dumb man. Like, I just told you 5 minutes ago. And listen, like, it's not that I'm not listening. It's like genuinely like this internal instinct that moms have is phenomenal. Like men will never understand that ever. Maybe we might understand hunting and gathering kind of thing, but not understanding like
the maternal,
the mental health of it all. It's very
yeah,
challenging, very challenging.
yeah. Speaking of mother's intuition, what is your, like in your practice, how have you experienced like times when moms just like knew that something was wrong or knew that something was going to be the case?
One of my patients, I think this was 2 years ago now, she was a high risk patient. She had an IVF pregnancy. She was older, and she was close to term or at term, like 37 weeks or change. She was out at dinner and she's like, something was off. She didn't call me. She didn't tell me anything. She just went to the hospital. She's like, something is off. Ends up at the hospital. And for some reason, I was looking at like the hospital. They had called me from the hospital to say, hey, look at the baby's tracing. And I looked, the baby's like heart rate had started to get less and less like prominent, like something was off. And that was going on for like 20, 30 minutes. I jumped in my car and I booked it. I got to the hospital and I'm like, we are taking you for a C-section right now because there's nothing more that I could do. We got to get this baby out. Her intuition just like kicked in, like something was just off. Like, I don't know what it was. It's just that maternal instinct.
Yeah.
And I hope every patient has that. Like, and sometimes it's just anxiety and that's okay. But sometimes there's just like something more that it just kicks in and just tells you, hey, pay attention. Pay attention.
Yeah. That is so cool. The way biology works is just so amazing.
Yeah. Oh, yeah. I
That's
love it.
so this has been incredible and so informative. Is there any like last words that you want to share with moms, pregnant women, people in
Um,
postpartum?
Number one is trust the process. Honestly, like trust what you want. Understand plans and preferences can change. We're not here to get you or like take you out of what the experience you want. Let it be mutual. Let it be an understanding that we're here to. Obstetrics is an art. It really is. It's not a study of something. It's an art. There's an art to laboring. There's an art to getting to, and there's a lot of medical stuff and there's a lot of non-medical stuff that works, and we should be open to that. So come with good intentions. We want to come in with good intentions. Let's work together and let's get you to the experience that we hopefully can provide, whether that's at home or whether that's in a hospital or something in between, and start your family and make things happen.
I love that.
Yeah.
So for our moms who are in the LA area, where
Yeah.
can they find you?
You can find me on Instagram. My handle is at Danny Niku MD, so DANNYNIKU MD. That's I do a lot of educational stuff. I do TikTok also. That's where I put a lot of stuff. And then my offices are I'm a private practice in Beverly Hills. You can also find me on Instagram, not Instagram, on my website, Daniel Niku MD. And always give us a call if you have any questions. Happy to take you on for any obstetrical or gynecological issues. And listen, if I can't be the one, I'm sure we can help you find someone that will take good care of you.
That's awesome. Well,
Yeah.
thank you so much, Dr. Niku. This has been incredible. I really appreciate you
Thank you
answering
so
all
much
my
for having
questions.
me.
And
Of
yeah,
course.
of course.
Have a good one.